Case Study Number 12. Summary: Sarah Johnson, a 40-year-old female. Sarah presents with severe abdominal pain, nausea, and vomiting. She has a history of gallstones and obesity. Current situation: Sarah arrives at the emergency department with severe right upper quadrant abdominal pain that radiates to her back and shoulder. The pain started suddenly a few hours ago and is accompanied by nausea and vomiting. Her vital signs are: blood pressure 140/85 of a millimeter of mercury, heart rate 100 bpm, respiratory rate 20 breaths per minute, temperature 38.3 degrees Celsius 100.9 degrees Fahrenheit, oxygen saturation 98%. Questions. Question 1. What are the potential diagnoses and pathophysiology for this patient? Answer A. Acute cholecystitis. Acute cholecystitis is the inflammation of the gallbladder, typically due to the obstruction of the cystic duct by a gallstone. Pathophysiology includes increased pressure in the gallbladder, ischemia, and bacterial infection. Key points include prompt diagnosis and treatment to prevent complications such as gallbladder rupture. Answer B. Biliary colic. Biliary colic occurs when a gallstone temporarily obstructs the cystic duct, causing severe pain. Pathophysiology involves the temporary blockage of bile flow, leading to increased gallbladder pressure and pain. Important considerations include pain management and evaluation for potential cholecystectomy. Question 2. What immediate nursing care is required for this patient? Answer A. For acute cholecystitis, administer pain relief medication such as NSAIDs or opioids as prescribed. Administer antiemetics for nausea and vomiting. Start 4 fluids to maintain hydration. Monitor vital signs, especially temperature and pain levels. Answer B. Biliary colic. Administer pain relief medications such as NSAIDs or opioids as prescribed. Administer antiemetics for nausea and vomiting. Start 4 fluids to maintain hydration. Monitor vital signs, especially temperature and pain levels. Question 3. What diagnostic tests and treatments are necessary for this patient? Answer: ultrasound of the abdomen, to visualize the gallbladder and detect gallstones or inflammation. Complete blood count CBC, to assess for infection or inflammation. Elevated white blood cell count. Liver function test LFT, to evaluate liver function and detect any bile duct obstruction. Amylase and lipase levels, to rule out pancreatitis. Electrolyte panel, to assess for imbalances due to vomiting. Blood cultures, if sepsis is suspected. Medication information. NSAIDs, for example, ibuprofen, to reduce inflammation and provide pain relief. Considerations: administer as prescribed, monitor for effectiveness and side effects. Side effects: gastrointestinal upset, renal impairment. Contraindications: peptic ulcer disease, severe renal impairment. Opioids, for example, morphine, to provide pain relief for severe pain. Considerations: administer as prescribed, monitor for effectiveness and side effects. Educate the patient on the use of opioids for severe pain. Side effects: respiratory depression, constipation, sedation. Contraindications: severe respiratory depression, hypersensitivity to opioids. Antiemetics, for example, ondansetron, to relieve nausea and vomiting. Considerations: administer as prescribed, monitor for effectiveness and side effects. Side effects: headache, constipation, dizziness. Contraindications: known allergy to ondansetron,